In healthcare, confidence is everything. And when you're monitoring your patient, you're trusting that all the numbers on that screen reflect reality. They are accurate, immediate, actionable. But think about where those numbers come from, where a sensor meets someone's skin. That's the connection point that informs critical decisions. It's where care begins.
That's why Philips sensors and cables are put through what we call V&V. They're verified for safety, validated for performance, and approved to work as part of the entire Philips ecosystem. That means inflating and deflating cuffs thousands of times, tugging and twisting cables, stress testing every connector, every solder point, because your monitoring supplies should meet the strength of your care team.
You see the impact on the floor. Accurate, reliable data originates at the point of contact, the patient's skin. That means a bad signal in will lead to a bad signal out. It's not just frustrating, it's dangerous.
Those third-party supplies, I've seen what clinicians are forced to do. They cut tubing, tape mismatched connectors, rig other makeshift fixes just to make something fit. I understand why. It's often budget-driven. But that kind of improvisation introduces risk that can't be calculated in a spreadsheet.
I've been in situations where a patient's vitals read erratically, and we spend precious minutes chasing down the issue, only to find out it's a third-party sensor that isn't properly calibrated. Even worse, a bad connection can trigger false alarms that distract from real patient needs, adding to alarm fatigue, eroding trust, and impacting response time.
In those situations, nurses lose time troubleshooting. Biomed teams get pulled in to investigate. Warranty claims are voided. Service calls stack up, adding to the cost of reorders. All the while, clinicians' trust fades.
There are also clinical workflows to consider. Think about patient transport. You have different units using different supplies. A nurse has to stop, disconnect, track down a compatible part, reconnect, resync. That's minutes lost, and in emergencies, that's everything.
It's why many hospitals are working with clinical adoption consultants to streamline compatibility and optimize inventory. We've also designed our measurement tools to consider the total cost of ownership, not just upfront, but over years of use. And we've created long-term supply contracts that are easier to manage, more predictable, and fully aligned with your system.
Generic supplies may look the same, but there's no guarantee that they're made or tested the same. So we can't be sure they'll perform the same.
Sensors, cuffs, lead sets, they're not just accessories. They are direct connections to your patients. When you use Philips supplies, you know they're gonna work. No troubleshooting, no second guessing, just trust.
Every choice we make at Philips has clinical performance and confidence in mind, because when it comes to patient care, confidence is not a luxury, it's a requirement.